What is a good dressing change protocol for surgical wounds? A common protocol is to change the dressing, sometimes daily, to allow the clinician to inspect the wound and check that all is well. But is this the right approach? Well, according to 2 recent consensus reports, it is not. The reports, written by 17 surgeons from Europe, Middle East, Asia Pacific and the US, conclude that surgical dressings should stay in place for as long as possible, with the dressing not being changed unless it is clinically needed. By keeping surgical dressings in place, you can improve patient outcomes by reducing the risk of contamination and surgical site infections, and facilitating optimal undisturbed wound healing. You can also reduce costs by reducing the overall cost of consumables and the cost of unnecessary dressing changes. Let's take a closer look at the cost bit. Dressings can be really cheap. Why does it matter how many changes are made? Well, if you think about it, every dressing change will drive a lot more than just the cost of a dressing. A proper aseptic dressing change means that you need a sterile surface, like a small drape, gloves, sterile forceps, swabs, and a bowl of saline solution for every dressing change. If you sum all this up, how much does it really cost? And how much time do you spend on dressing changes? Does daily dressing changing really bring value? In a randomized trial, this was investigated, and an interesting result became clear. In the trial, an advanced dressing was compared to a cheap conventional one. Of the patients treated with the advanced dressing, over 70% needed no dressing change the first week, compared to 94% of patients treated with the conventional needed at least one change. Therefore, reducing the number of dressing changes drives value. It allows for undisturbed wound healing, reduces the cost of consumables, reduces the time spent on dressing changes, and reduces the potential for surgical site infection.